I'm Martina Tierney, Occupational Therapist and Clinical Director at Seating Matters. In the video that follows, I'm going to introduce Patti, who is the Director of our Pressure Management Programme and a Clinical Nurse Specialist. She's going to discuss the prevention and treatment of pressure ulcers and how we all as clinicians can have an impact on the reduction of pressure ulcers worldwide.
In this educational video, we're going to talk about pressure ulcers or pressure injuries and how they're managed in hospitals and other care facilities. We'll look at some common practices that you use now and some clinically based researched evidence practice. You know, so much fantastic work has been done with clinicians for pressure ulcer management and prevention over the years, and really need to applaud the clinicians, the ETs, the OTs, the PTs that have worked so hard to make sure that our patients are well taken care of. As a nurse, I know how busy I was through the course of my day, and I was so reliant on those specialists to help me make it through the day on their advice and counsel for patients so that we could manage patients more effectively with better outcomes. So over the years, we've really come up with some great clinically based, evidence-based treatments for pressure ulcers, one of them being repositioning. So as you know, repositioning is really turning from side to side, back to side, side to back, and really the recommendation is to do that every 2 hours while a patient is in bed. Repositioning also includes getting a patient out of bed when they're in a chair, making sure that they're positioned properly, whether you're tilting back, varying that degree, always looking at a way to offload pressure from bony prominences on a patient. Positive of repositioning is you're actually moving the patient, moving that body so the blood flow is allowed to get back into those places where there's been pressure. One of the downsides or difficulties is when you're repositioning somebody every 2 hours, that's a huge workload in nurse or OT or PT's already very busy day. There's also a great risk to the patient and to the staff when you're moving somebody that many times through the course of the day, whether you're getting up into a chair or even just positioning in a bed, rolling from side to side. There could be great risk to both patient and to the staff involved. Another therapy that I'm sure a lot of you are used to and have been using quite significantly are mattresses and therapeutic surfaces. They've been around for quite some time now. They do actually have some evidence-based practice behind them, and we've come leaps and bounds from what we used to have as the old green mattresses, I'm sure everybody remembers in acute care facilities, to the specialty surfaces that we have now, low air loss, gels, mattresses that turn themselves. There have been huge improvements in surfaces in helping prevent and treat pressure ulcers or pressure injuries. Therapeutic surfaces have been considered the gold standard for pressure ulcer management, pressure ulcer treatment, but there certainly are other modalities that we know are just as important as the surfaces to help prevent those pressure injuries. Another component in pressure ulcer prevention is hydration and nutrition. Of course, we all know that a patient needs to be adequately hydrated. Their nutrition needs to be top-notch, especially when we're considering protein, albumin levels. We need to pay close attention to those factors to make sure that the patient's getting the adequate nutrition they need to help prevent and help heal pressure ulcers. In dressing management, we have so many advanced wound care dressings, lots of range, lots of things for clinicians to choose from, including back therapy, which certainly has its place in the treatment of many different types of wounds, especially pressure ulcers or pressure injuries. Another important factor are prevalence and incidence studies, and we've really come leaps and bounds in the development of P&Is or prevalence and incidence. Knowing where these wounds come from is instrumental. So the prevalence is very important. It tells us on any given day what types of pressure ulcers are in a facility, but the incidence is critical for a facility to move forward with a pressure prevention program. An incidence really tells you how pressure ulcers are grown in your facility, where they come from, how they're managed. So that's where you can become very critical in developing a program that's suitable for your facility. So prevalence and incidence is a two-part system. The prevalence is actually, if you can imagine, a snapshot of what's going on in a facility in any given day. So it won't tell you where the ulcers come from, but it'll tell you on any given day that you have a certain amount of ulcers and they're staged accordingly. An incidence is then coming back after a period of time, and generally the incidence is done after the average length of stay has happened, and you'll look at the people that were there for the prevalence. The incidence then again will show you which pressure ulcers were actually homegrown, which actually happened in the facility, so you get a really good picture of what's going on at your facility at that particular time. So the average prevalence is generally between 12 and 19%. Average incidence, 0, which would be fantastic and ideal. generally 0 to 5.46%. So all this work is great. We've done so many wonderful things to help reduce the incidence, but they're still there. We're still seeing an increase in pressure ulcers. We're still seeing an increase in pressure injuries.
So Patti, you've told us all about the available treatments and preventions worldwide, so why is there still 1 in 5 people across our healthcare system in the world having pressure ulcers?
We certainly believe that one reason for this is that the chairs have been neglected. There really has been a lack of research, a lack of technology, a lack of any evidence-based practice when it comes to looking at chairs. Lots of time and attention on surfaces and very little time and attention on chairs. So that ends up, we end up putting patients after they've had maybe great therapy for 12 hours out of the day when they're in a surface, we're putting them into a chair where really often we're undoing all the hard work that they've been doing through the night. So often healthcare facilities, long-term care facilities, acute care facilities are using chairs that lack research, that are outdated, they may be much older, they don't afford the ability to put a patient in proper posture to relieve pressure. Until the chairs are actually properly addressed and have some research behind them, we continue to see that increase in many places of pressure ulcers throughout different facilities. We are seeing that pressure ulcers aren't actually reducing and in some cases are increasing. We're seeing great results in facilities that are actually using chairs that have research behind them. Research that actually supports an 88.3% reduction in pressure ulcers. These are chairs that actually have been developed by clinicians that know what patients need and require, know the postural issues that plague our patients on a day-to-day basis. So facilities that are getting the right equipment, actually getting the support with training and technical support and clinical support and active documentation of what's going on, that's where the magic happens. We're seeing great improvements in those facilities. The Seating Matters clinical team and I spend our days educating professionals like you on the pressure management program. As clinicians, we feel this is really important to share this knowledge with our colleagues to improve patient care. What that does for you is it decreases your pressure injuries for your patients in your facilities. If you'd enjoyed this video and found it valuable, please share it with your colleagues as well. For more information, tips, and advice, please contact us and request your free clinical handbook at seatingmatters.com.